Kelly and I work at BodyNew MedSpa, and I am a laser tech here. And this is our model Sid, and today I'm going to be doing the laser hair removal treatment to her underarms. The goal of the machine when we're doing laser hair treatments is to damage the follicle so that it no longer has blood supply to that follicle and the hair quits growing. So first off, when we do this treatment, when you come in, we'll have the area shaved that you're going to treat, which is her underarm, and then you'll remove any deodorant from the area. Okay, and then I'll repeat this on the other side. Okay, so now we have a nice clean surface, free of hair and free of deodorant to treat. Okay, and one of the things that we look for, one of the best candidates for these treatments, are lighter skin and darker hair follicle. The whole method behind this is the high intense pulse light, which is what we're using. This is made by Palomar. The intense pulse light seeks out pigment. So your goal is to damage the hair follicle, which has pigment, and spare the surrounding skin. And how we do that is we have her fill out a questionnaire. It's called a Fitzpatrick scale, and that gives us a guideline at what energy level to use on her and the depth of penetration of the light. Each light has a different depth of penetration. Where she has a little darker skin, we want to use a frequency of light that seeks out the pigment a little lower under the skin where the hair follicle is, rather than her surface pigment of her skin. So I had her fill out a Fitzpatrick scale. She is a Fitzpatrick 3, and so we're going to treat her with the red head. And once again, it goes a little deeper into the skin to damage that follicle. When we're doing these treatments, we always use a 20% overlap to ensure that we are covering all the surface area. One of the advantages over other equipment, this piece of equipment has a self-cooling head, so immediately when the spot size touches the skin, it is already cooled, which makes it very comfortable. And she's done. have finished with sits underarms. She will need to come back in about 5 weeks. We do treatments every 5 weeks to ensure that she is on a growth cycle, because you can only damage the hair follicles on the growth cycle, which is approximately every 4 weeks. So anywhere from 5 to 6 weeks, she will be ready for her next treatment. She may notice a little bit of itching for an hour or two after this treatment. What we see a lot of times is something called PFE, which is perifollicular edema. That's the endpoint that we look for that lets us know that the follicles have been damaged. So she may notice like a little red rash looking area, which should dissipate anywhere from an hour to a day after that. If it's uncomfortable, she could use aloe vera gel, or hydrocortisone will help with the itching, but usually it's never an issue for anyone. And she looks like she's doing. And then I would do the same thing if I was going to be treating her legs. I would want her shaven, clean shaven, before her treatment, and then she came in and I would just repeat the same process. You do the 20% overlap on her full leg. Legs are where you start to notice a little more of the perifollicular edema, because there's a lot of follicles in the leg, especially around the ankle and the knees. Generally, when we're doing the hair removal, you'll need a minimum of 5 treatments, depending on the density of your hair and the area that we're treating. You may need more. What I have seen is I've noticed that people need right around 7 treatments. And then you may need a maintenance treatment once a year thereafter.